And now we're going to look at an illustration of one of our patients whose ventricles enlarged over time. Okay, play. This is her lateral ventricles in a 3D reconstruction. And if you're watching carefully, you can see the ventricles get bigger over time. And particularly, look at the inferior lateral ventricles, also called the temporal horns. And you can play that again, and you can watch them getting longer. And you'll also see, in general, all the ventricles get bigger, as if you're inflating it or blowing air into them. And in this patient, this was associated with statistically significant enlargement of the lateral ventricles and decrease of brain volume and this patient, the time period was about 2.5 years from the start to the end of this set of data. And what we did, let me explain to you how we created this medical illustration. We took the patient's brain MRI data at time 1, created the NeuroQuant 3D reconstructed regions, including ventricles. And then we, and I say we, which was Michael Havranek, our medical illustrator, and we worked with him, but he did the lion's share of this work. He took the data at time 2, which was about 2.5 years later, and also did the reconstruction in 3 dimensions of the brain data, including ventricles. We then did a morph movie technique where you take image 1, compare it to image 2, and you interpolate in between so that you can see it shrinking and turning into image 2. So that's how we did it. This is another way we looked at progressive atrophy in a patient. This is a different patient. What we did here was we took the day of accident CT scan and compared it to a later MRI scan. Again, as I mentioned earlier, you have to be careful comparing CT to MRI. You have to be careful to get the slice angles lined up correctly. But we did that in this case and then used the morph movie technique to morph one into the other. The reason this is helpful is, let me explain to you why the morph movie technique is helpful. Because if you look at this one point in time image, the CT scan, which is of the frontal part of the brain, and then compare that to the next image on the next slide, which is the later MRI, and then ask yourself the question, did anything look like it atrophied? And we'll look at that again. Back up a slide. Look at all the brain regions, the ventricles, keep it in your mind. Now look at the next slide and try to figure out, did anything atrophy? It's a little bit hard to tell, I would say. You'd have to go back and forth really carefully. You might be able to figure it out. But if you do the morph movie, it's going to be easier to see. Next slide. And we'll play this movie and you can watch it and see if it's anything looks like it shrinks to you. Now you may have seen that right frontal lobe especially shrinking. We'll play it one more time and you can look at it. And look especially here at the right frontal lobe. And you can see that area shrinking while the rest of the brain looks pretty much the same over the time period. Next. Okay, regarding the community acceptance of NeuroQuant, NeuroQuant is currently used in at least a dozen clinics and radiology centers across the United States. So it's been catching on and it's becoming more and more commonly used. Now, let's talk about the clinical implications of this work with MRI and using NeuroQuant to measure MRI brain volume. First of all, objective signs of brain injury, like MRI, provide vindication for our patients. Let me explain to you what I mean by that. First of all, MRI is objective because you cannot exaggerate the results. You can't fake the results. There's nothing a person can do to change what their brain structure is going to look like on an MRI. So that's useful, and it helps us understand what's the truth about what's going on in someone's brain. Provides vindication for our patients because our patients are telling us they don't feel right. They have trouble remembering. They have trouble thinking. They have problems with their mood. They have trouble sleeping, and so on and so on. And, you know, sometimes family members will wonder, was it really a brain injury or is my loved one just not really trying hard enough? Or other people may wonder, the patient themselves may wonder, maybe it's all in my head, they may say. And when they see that the brain is actually shrinking, and I will usually show patients images of their brain if they want to see it, which almost all of them do. And it concerns them, rightfully so, and I'm concerned about it. But they're curious and they want to know because they want to know what's going on. And but they feel, although they feel bothered by it, they also feel vindicated. In fact, there's a sense of relief often. A lot of patients say, I knew there's something going on, and I want to monitor this. The next point is that continuing brain atrophy can be a motivating factor for patients because it is so concerning. And if a patient, maybe they're not taking their medicine exactly as prescribed, yes, it has been known to happen. Maybe that CPAP mask they use for the sleep apnea is uncomfortable, they really don't want to mess with it. When they get this information that they really have a brain problem to the point that their brain is shrinking a little bit over time, sometimes it gives them the extra motivation to comply with the treatment that their doctor is telling them to comply with. Now the forensic, that is medical legal implications. It's often the case, and I've seen this in a lot of patients I've worked with and medical legal cases I've worked on, that defense specialists, physicians, or defense attorneys will argue that a patient does not have any objective signs of brain injury. And therefore, how can you be sure they had a brain injury? And this was true especially as recently as 5 years ago, before we had NeuroQuant, before we had a couple of the other recent techniques that allow us to look at objective signs of injury. And so, and I would come in and I would say, well, 5 years ago I would say, no, we don't have any abnormalities on MRI or no other objective findings. But you don't have to have objective findings. Most of the brain damage is microscopic. You can't see it with an MRI. So I would say that, and the defense physician would say, oh, it's not a brain injury at all. The jury would be sitting there wondering who's telling the truth or who's right. And they really, they're not brain injury experts or brain experts. It's probably hard for them to figure out. So now that we have MRI techniques, and we have not only the NeuroQuant, which is the subject of this talk, we have susceptibility weighted imaging, which can show signs of old bleeding. We have diffusion tensor imaging techniques, which will often show objective signs of injury in our patients. We have multiple techniques, and I can now say to a jury or the court system, yes, I think they have brain injury, and not only that, there are these objective findings. That helps to make it easier for a jury to understand what the truth is and what's happened to this patient's brain. And that's very important for the medical legal cases. And I may be biased, but I think MRI currently may be the best chance for finding objective findings of brain injury in our patients. There are some other techniques being worked on, biomarkers, certain blood tests or CSF tests, things like that. That's great, but I don't think they're ready for prime time as far as I understand it right now. And they may be, like the CSF test, may be a little bit more invasive than the MRIs. Okay. Here's some recommendations I would ask you to consider if you're a physician for your patients, or if you're a patient to ask your physician about. First of all, if you've had a brain injury or suspect you've had a brain injury, get a neuroquantable MRI as soon as possible. On the day of the accident, if possible, if not, as soon thereafter as you can. This means not just any old MRI, but a neuroquantable MRI. That means one done so that we can do a later NeuroQuant analysis on it. As I said earlier in the talk, you got to set up all the buttons on the MRI machine exactly right, and you can check that on the Cortex Labs company website, and then get your MRI. You don't have to do the NeuroQuant analysis the day you get the MRI or at the time you get the MRI. You can do that later, offline. You can do it weeks or months later. It doesn't matter how long you wait, because you got that MRI data, and it'll just be waiting for you when you're ready to analyze it. Next thing I'd recommend is that you get at least one, probably two follow-up MRIs about 6 and 12 months later, so that you can look for the progression of atrophy over time, and because remember, the longitudinal design, more than one MRI, is much more powerful for detecting signs of atrophy than the cross-sectional MRI, which is the one point in time design. And if in our patients, if there is progressive atrophy over the 6 or 12-month period, typically I'll recommend clinically to get another MRI every year thereafter until we stop seeing the progressive atrophy. Another point about the progressive atrophy is that not only does it show an objective sign of brain injury, but it places in time when the effect of brain injury occurred. And it places it after the time of the injury. In other words, we know there's atrophy occurring after the time of the injury. In the medical legal cases, it's often important to understand what caused the effects on brain structure or what caused the effects on the patient's symptoms. And the issue of pre-accident brain problems is a very important one. And a lot of our patients have pre-accident brain problems. It might be depression, might be alcohol abuse, a lot of things. And so the question comes up, okay, your patient had some brain atrophy. Was it due to the accident, or was it due to, when he divorced his wife 10 years ago and they had marriage counseling for 6 months before that, and he was on an antidepressant for a year after the divorce. And so by measuring the brain atrophy, brain volume after the accident, if we find progressive brain atrophy after an accident, in many cases that would be unlikely related to a brain problem which happened many years before, particularly if that pre-accident brain problem is fully resolved, or would not be likely to cause progressive atrophy years later. Okay, now the next point is that in addition to the NeuroQuant standard analysis, which is what Cortex Labs will give you automatically, I think it's useful to do the NeuroQuant extended analysis, which extends the standard analysis in a couple important ways. First of all, we have 15 brain regions instead of 3 regions given with the standard analysis. And secondly, we can do the longitudinal analysis looking at change over time and compare that to normal controls change over time that we talked a lot about in this talk. Okay, and these are some of the several people who have helped me give clinical care to these patients and to do this research, and I greatly appreciate their help. Thank you for listening to this talk on MRI and NeuroQuant in our patients with traumatic brain injury.